problem for people with MS who were diagnosed in the 80s and 90s was that there was really no treatment, and neurology departments weren't geared up to any kind of specialism in MS, because the only kind of treatments there were symptomatic. So yes, bladder treatment, spasticity, but no treatment to affect the course of the disease, and that was what, of course, the disease-modifying drugs were doing. So there were, if neurology was the Cinderella of medicine, I think MS was the Cinderella of neurology. It was a big step for the MS Trust to get involved in the risk-sharing scheme. We'd been involved right through with NICE during the appraisal of the drugs as to their cost effectiveness, and we've been lobbying very hard on behalf of people with MS that they should have access to those drugs. And when NICE came back with a negative recommendation, the only way that people with MS were going to get the drugs was if a more cost-effective way of providing them was facilitated. And that was what the risk-sharing scheme was, and that was why the MS Trust agreed to get involved as honest broker, facilitator of the scheme. It was a big step. We were quite a small charity. It was a high-risk strategy for us. We were, potentially the jam in the sandwich between the Department of Health and the pharmaceutical companies. We were aware of how that could look, but we decided to do it because it was the only way we were going to get the treatments, not just the drug treatments, but treatments across the board for people with MS, and investment in MS specialist services.
The landscape for people with MS has changed hugely by the risk-sharing scheme. It absolutely transformed care for people with MS. Before the risk-sharing scheme, fewer than 2,000 people who were eligible for treatment were actually receiving treatment. That was ridiculous in a population of around about 85,000 people as we saw it at that time. We've now got over 20,000 people receiving the treatments that they need. We're still a long way behind in terms of prescribing across Europe, but it's getting better. And at the start of the scheme, we only had 80 MS specialist nurses across the UK, and that was far too few at the time. In order to get people on treatment quickly, we needed to invest in MS services and the infrastructure across the UK, and that was the big thing that the risk-sharing scheme really did and achieved. So by 2003, we had 170 MS nurses in post, all of them trained by the MS Trust, and that training was funded by the risk-sharing scheme. Prior to the scheme, there were about 20 specialist MS centres across the UK who potentially could prescribe. As a result of the scheme, we saw over 70 MS prescribing centres. So the investment attracted neurologists. It created new prescribing centres that were closer to the homes of people with MS. And I think the really big thing to note about the MS specialist nurses and the increased numbers of nurses was that they were able to help everyone with MS, not just those who were eligible for treatment.
And true of all health professionals, physiotherapists as well, and OTs, wasn't it, Joe? Because as more disabled people were going into the MS treatment centres who hadn't been before, their needs were being recognised, and the specialist health professionals needed to treat them in terms of rehab, were being trained again by the MS Trust in many cases.
I think that's right, and I think actually what you said about MS being the Cinderella of even neurology is so true. And for once, the risk-sharing scheme gave people with MS hope, because when there was a negative decision and the drugs weren't seen as cost-effective, overnight people really did lose hope, didn't they? It was such a hammer blow, really. Yeah. And the risk-sharing scheme generated real investment, real opportunity and hope. I think, so one of the biggest things we can learn from the scheme is definitely the power of the patient voice. I don't think the scheme would have happened had it not been for patient groups, the MS Trust, encouraging people to get very loud. What do you think?
Yeah, I think that's true, and it's the power of small as well, isn't it? They might be small voices, but if you put them all together, they get quite loud. And I think there was an unwelcome recognition at some point by the powers that be that people with MS were actually not going to go away. And it wasn't going to be just the people who might get the drug therapy. It was going to be everyone with MS saying, it's our turn now.
I think that's true. And then also the power of the community coming together. So it wasn't just the patient voice, it wasn't just the patient groups. You know, it was the Department of Health getting involved, the ABN, UKMS, SNA, and of course the pharmaceutical companies were, you know, important partners in the scheme. So the power of the community coming together, that made such a difference. And I think everybody should be commended for making some very bold decisions, but particularly the MS Trust, because we were small. It was a big risk, but it was the only way to make this happen. And without people like Chris, Nicola Russell and Tracy, I don't think the risk sharing scheme would have A, happened, and B, come to the end so that we've got published data. And you know, the resulting investment has absolutely transformed care for people with MS. People with MS still face many, many challenges, and the MS Trust will continue to try and address them. One of the key challenges that we have been trying to address for 25 years now is the number of MS nurses. So although we have approximately 300 MS nurses in the UK now, it actually equates to about 250 because not all are full-time. And we need at least 50 more, and probably many more than that. So obviously the MS Trust is now running the Specialist Nurse Programme, where we fund MS nurses in the areas of greatest need. And we've generated lots of evidence about the value of MS nursing over the years. It's been a constant theme in our work. So we will continue to do that, and we will continue to campaign for more and more MS nurses. And also MS specialists across the board, really, because, as you said before, all of our allied health professionals are so important in terms of MS care. And as we see new drugs being licensed, particularly for progressive MS, we need to ensure that they are made available to people with MS, because, you know, it would be devastating to go back to the early 2000s and have to fight this battle again for a new group of people. So we need to ensure that these drugs are made available for people, and that we continue to invest in the infrastructure to attract neurologists. We're still short of neurologists, we're short of MRI time, but the MS Trust will continue to, I think, you know, you hate to use the word fight, but sometimes it is a fight, isn't it? And that's what we want to do.